So today I want to talk about diabetes mellitus. So many people get diabetes. They never even know say they get diabetes. Diabetes na serious health condition. When it be say the person body either not they produce enough insulin. Insulin na hormone when be say they break down blood glucose, right? The person body feel not they produce enough insulin, or the person body no they use the insulin when they produce properly. It go come make the blood glucose, which is the sugar for the blood. Since insulin they break down blood sugar, and the person body no they use the insulin properly, or the person body no they produce insulin, it go make the blood sugar of that person they high. Now they call diabetes mellitus. Okay, you get 3 types of diabetes mellitus. Number 1, type 1 diabetes. Type 1 diabetes na condition when be say the person no dey produce insulin at all. Like the person body no dey produce insulin at all. People when get type 1 diabetes, they go need to dey give themselves insulin injection every day. Depends on how the doctor tell them they take them. Usually now after every meal or before every meal, right? They go need to live on insulin injection. That one, there's nothing they can do, no cure for that one. Okay, this type 1 diabetes, they diagnose them when people they like very young, maybe like 2 years, some 1 year. They already tell them say they get type 1 diabetes, or during adolescence, right? So they have to live on insulin, it not get cure. Type 2 diabetes, now another type of diabetes. This one, now the kind of diabetes when be say the person they produce insulin, oh, but the insulin not they reach, is not enough to break down the sugar when they the person body, right? The person they produce insulin, but it not reach, or the person they produce insulin, but the body not they use them well. The insulin when the person they produce, the body not they use them well to break down the blood glucose level. So in that case, the blood glucose level go still they high, right? People when they get this type 2 diabetes, mostly now because maybe they overweight, or they get poor diet, or they're not really they physically active. So that type 2 diabetes, to some extent, if it's still they reversible, if you reverse them by proper diet, when people go on strict diet, if they go on proper diet, if you go back, then if they more physically active, if you go back, or they still use tablets to control them. So that one are the 3 ways when you go fit manage that type 2 diabetes. Most times they go back, but it's something you can live with. Diabetes as a whole, whether not type 1, type 2, na condition when people feel they live with. It's not just the by person like that. Okay. The 3rd type of diabetes, now gestational diabetes. Gestation means pregnancy, right? This type of diabetes, they happen when we say some women when they carry belly, they're not diabetic before, but when they carry belly, that pregnancy will come trigger diabetes for their body. These people when get this kind of gestational diabetes, usually when the person born the pikin, the body go back to normal. The gestational diabetes they go away, right? But people when they experience gestational diabetes, they at a higher risk of developing type 2 diabetes. Okay, but the fact that they get gestational diabetes, you know, me say they go must get type 2 diabetes at the end, though, but they are at higher risk to develop type 2 diabetes compared to those who not get gestational diabetes, right? So that are the 3 types of diabetes. When they type 1 diabetes, they have to live on insulin. They take insulin injection every day. Type 2 diabetes, they can control it through diet, through exercise, through tablets. While type 3, no sorry, not type 3, why gestational diabetes, now when somebody get belly, during that pregnancy, the person can't develop diabetes. After the person born the pikin, the diabetes go. So those are the 3 types. I will come back for part 2 on diabetes, because diabetes is a very broad topic. It get plenty branches. Okay, thank you, bye.